Hello students, good morning. Today we will start part 2 of female pelvis. In previous lecture we have already discussed about the bony aspects of female pelvis, bones of the female pelvis, and today we will discuss about midwifery aspect of female pelvis. So in this we will start with the regions of pelvis. Actually, the female pelvis is basically divided into two regions, true pelvis and false pelvis. So what is true and what is false we will discuss here. The true pelvis is the pelvis through which actually childbirth process takes place. So it is a bony canal through which the fetus must pass during birth process. It is divided into again three parts: pelvic brim, pelvic cavity and pelvic outlet. So let us see them one by one. The pelvic brim. The superior circumference forms the brim. So here brim is formed by this circumference. The included space being called inlet. Okay, and the brim is also known as inlet because the fetus enters into pelvis from here. It is round except where the sacral promontory projects into it. Actually, basically the structure is rounded, but here sacral promontory projects into it. So this is the pelvic brim. We should be familiar with the fixed points on the pelvic brim. Whenever we study about midwifery, there are certain landmarks which we should know. Then we can understand the whole process of delivery and labor easily. So what are these points? These points are known as landmarks, and in examination you may write the 9 landmarks of brim. So let us start. There are 9 landmarks on the brim starting from symphysis pubis. So symphysis pubis is anteriorly here where the pubic bones meet or the joint of both pubic bones. Then pubic crest. Okay, here there is a slight projection of the pubic bone, that is known as pubic crest here. Then pubic tubercle. Crest is a line, elevated line, and tubercle is a small projection. Then there will be pectineal line. After pectineal line there is iliopectineal eminence. Okay, again a broad projection. Then iliopectineal eminence. After iliopectineal eminence there is iliopectineal line here. Then sacroiliac joint. So this one is sacroiliac joint where sacrum and iliac meet. Then ala of sacrum or wing, this one, and then sacral promontory. So these are main landmarks of the female pelvis. Then second part of true pelvis is pelvic cavity. So what is pelvic cavity? Pelvic cavity is the true pelvis extends from the brim or inlet to outlet inferior. The anterior wall is formed by pubic bone. So anteriorly there will be pubic bone and symphysis pubis, and its depth is only 4 cm. While the posterior wall is formed by the curve of sacrum. So this is the curve of sacrum. So this portion will be pelvic cavity. Okay, inlet, pelvic cavity and outlet. The posterior portion is about 12 cm in length, and this is because the difference of these measurements, because this is longer one, this is smaller one, so this pelvic cavity becomes a curved structure. Okay, in this way. The lateral wall of this cavity are the sides of the pelvis, which are mainly covered by obturator internus muscle. This cavity contains pelvic colon, rectum, bladder and some of the reproductive organs. The rectum is placed posteriorly. So towards sacrum there will be rectum. In the curve of the sacrum and coccyx, the bladder is anterior behind the symphysis pubis. Okay, and in between there will be uterus. Now we come to pelvic outlet. The lower circumference of the true pelvis is very irregular and the shape is enclosed by, it is called outlet. So this is rough shape and it is a diamond shaped structure. Basically we have two types of outlets, anatomical outlet and obstetrical outlet. What is anatomical outlet? It is formed by the lower borders of each bone together with the sacrotuberous ligament. So sacrotuberous ligament and all bones, they form the anatomical outlet. And what is obstetric outlet? It is the greater practical importance because through which the fetus comes out. That is pelvic outlet. It includes the narrow pelvic strait through which the fetus must pass during delivery. The narrow pelvis strait lies between the sacrococcygeal joint. Okay, so actually the sacrococcygeal joint is the actual landmark from where we can measure the pelvic outlet, or we can say the outlet through which the child will, the fetus will come out. The joint and the joint between ischial spines, okay, or ischial spines will be laterally and they will make the boundary of outlet, and anteriorly there will be the lower border of symphysis pubis. So in this way this outlet is formed. Obstetric outlet especially. It is the space between narrow pelvic strait and the anatomical outlet. This outlet is diamond shaped. So it is just above the anatomical outlet. Now we come to false pelvis. So the false pelvis is situated above the pelvic brim. So this is pelvic brim and this is false pelvis. It is formed by the upper flared out portion of the iliac bones, iliac fossa. It protects some abdominal organs and otherwise it has no significance in midwifery. So in midwifery we are concerned with only true pelvis. Now we come to very important aspect practically, the diameters of brim, pelvic diameters. So there will be three types of pelvic diameters: diameters of brim, diameters of cavity and diameters of outlet. So first we will start with the diameters of pelvic brim. Pelvic brim have basically three types of main diameters. What are those? Antero-posterior, or also known as conjugate diameter, this one. Then oblique diameters, two oblique diameters are there, and one transverse diameter. Okay. So in gynecoid pelvis, the transverse diameter of pelvic brim is longest, that is oblique diameter 13 centimeter. Okay, so this is 13 centimeter. The antero-posterior or conjugate diameter, it extends from the sacral promontory to the symphysis pubis. So conjugate diameter will be straight, antero-posterior. Three conjugate diameters can be measured when we discuss about AP or antero-posterior diameter. There will be three diameters. One is anatomical conjugate, which averages 12 centimeter and is measured from the sacral promontory to the uppermost point of symphysis pubis. Then there will be obstetric conjugate, which averages 11 centimeter and is measured from the sacral promontory to the posterior border of upper surface of symphysis pubis, which is 1.2 centimeter lower This conjugate is of significance to the midwives because it represents the available space of passage of the fetal head through the bony pelvis. Then internal or diagonal conjugate. So it is the lowest portion at the symphysis pubis from where we measure it up to the sacral promontory. It is also measured anterior-posteriorly from the lower border of symphysis pubis to sacral promontory. It may be estimated by when we do PV examination as a part of pelvic assessment, and it should be measured as 12 to 13 centimeter. Then we come to oblique diameters. Oblique diameter extend from the iliopectineal eminence. Okay, so this is iliopectineal eminence and up to the where sacroiliac joint. Okay, so there are two oblique diameters. It averages measurement is about 12 centimeter. So oblique diameter will be 12 centimeter. The left oblique diameter arises from the left sacroiliac joint and right one arises from the right sacroiliac joint. Okay. The transverse diameter. Now we come to the third diameter. It is largest diameter of pelvis or pelvic brim in gynecoid pelvis. It extends across the greatest width of brim. Where we find the greatest width, there will be a transverse diameter. It measures 13 centimeter. Now we come to a special diameter that is known as sacrocotyloid diameter. It passes from the sacral promontory to the iliopectineal eminence. Okay. Again, there will be two such diameters. It measures 9 to 9.5 centimeter. It is important because sometimes the posterior portions of occiput, when the parietal eminence of the fetal head may caught here or may be arrested here. Okay, now we will come to the diameters of pelvic cavity. The cavity is basically circular and the measurements are practically not possible to measure. Still, we assume that all the diameters, anterior, posterior, transverse and oblique, they all are equal and measures 12 centimeter. Now we come to diameters of outlet. The outlet, which is diamond shaped, has three diameters again: anterior posterior diameter, oblique diameter and transverse diameter. The anterior posterior diameter extends from the lower border of symphysis pubis to the sacrococcygeal joint. Okay, it measures 13 centimeter as the coccyx may be deflected backward during the labor. So this diameter indicates the available space for birth. Oblique diameter, although there is no fixed point for measurement of oblique diameter, but still it lies between the obturator foramen and sacrospinous ligament, and the measurement is being taken as 12 centimeter. Then transverse diameter is extend between the two ischial spines and its measurement is 12 to 11 centimeter. It is the narrowest diameter in the pelvis. The plane of the least pelvic dimension, we call it the plane of least pelvic dimension, and is said to be the level at ischial spine. If we measure these pelvic diameters and we want to write in the form of table, we can write like this: brim 11 centimeter, 12 centimeter, 13 centimeter, anterior, posterior, oblique and transverse, then cavity 12, 12, 12, all are equal, and outlet 13 centimeter, 12 centimeter and 11 centimeter. Okay. So at brim, maximum width will be transversely, and at outlet maximum width will be at antero-posterior diameter. So keep in mind. Now we come to the types of pelvis. Normally, 4 types of pelvises are there. The normal is gynecoid, other style abnormal we can say, and sometime if these types of pelvis are there, cesarean section will be the choice. So 4 types of pelvises, these are gynecoid, platypoid, android and anthropoid. Okay. When we see the features, in gynecoid, brim is rounded, while in android, brim will be heart-shaped, anthropoid, long oval, and platypoid, kidney-shaped. For pelvis, just before starting the pelvis, initial part of the pelvis, generous, means good space. Here it will be narrow, and it will be wide. Side walls in gynecoid, side walls are straight, while in android it is convergent, and in anthropoid it is divergent. Ischial spines are blunt in gynecoid, while prominent in android. Anthropoid and platypoid have again blunt ischial spines. When you see the sciatic notch is rounded in gynecoid, while narrow in android. Anthropoid and platypoid have wide sciatic notches. Subpubic angle, that's the angle below the symphysis pubis, is of 90 degree in gynecoid, less than 90 degree in android, more than 90 degree in anthropoid and platypoid. Then incidence means how much is the chances of finding the gynecoid pelvis in females. So 50% chances are there. For android, 20% chances. For anthropoid, 25% chances, and for platypoid, only 5% chances are there. Other pelvic variation, sometimes due to congenital malformation, some other type of pelvises we may find. One is high assimilation pelvis. This occurs when fifth lumbar vertebra is fused with the sacrum and angle of inclination of the pelvic brim is increased. Engagement of head is difficult, but once achieved, normal labor can be achieved, or we can have normal delivery. But in deformed pelvis, where deformation may result from the developmental anomalies, then there will be difficulty in normal delivery. This may be due to any dietary deficiency, injury or disease, such as negligee pelvis. What is negligee pelvis? It is a congenital disorder due to certain arrested development during fetal development. One of the ala of sacrum is imperfect. Okay, and due to this, there will be imperfect sacroiliac joint, and pelvis is obliquely contracted at all level, but more marked at the outlet. So again, normal delivery is not possible. Cesarean section may be the choice. Then Robert's pelvis. It is also a congenital disorder. This is an extremely rare abnormality, and where the ala of both sides are absent and sacrum is fused with hip bone. Delivery is done again here by cesarean section. Now we come to pelvic inclination. What is pelvic inclination? When a woman is standing upright, her pelvis is in inclined position. Okay, the anterior superior iliac spine are immediately above the symphysis pubis. The brim is tilted like this. If the line joining the sacral promontory to the top of symphysis pubis is extended, then it will form 60-degree angle with the horizontal floor. And in the same way, here you can see in this picture also, if a line joining to the center of sacrum here and we extend it through the symphysis pubis, then it will form 30-degree angle. And when the woman is in lying down position, the same angle are made horizontally. Okay, and this we should keep in mind while doing abdominal examination. Now, pelvic planes and axis of the pelvic canal. These are imaginary flat surfaces at the brim, at cavity and at outlet. So 3 planes are there, and then curve of Kars. What is curve of Kars? A line, imaginary line drawn exactly halfway between the anterior wall and posterior wall of the pelvic canal. It will be a curve through which fetus comes out. You can see in this picture. So this imaginary line is the curve of Kars through which the fetus is emerging, okay, or coming out of outlet. Now pelvic floor. So what is pelvic floor? Actually, pelvic floor is like a sling. It is formed by muscles and some ligaments or soft tissue. It fills the outlet of the pelvis and supports the pelvic organs. It forms a diaphragm-like structure of muscle that's slung like a hammock. And these muscles come from the walls of the pelvis and passes through the pelvic floor. There are 3 holes: urethra, vagina and anal canal. What are the functions of pelvic floor? Pelvic floor supports the pelvic and abdominal organs. Its muscles are responsible for voluntary control during micturition, defecation and play important role in sexual intercourse. During childbirth, it influences the passive movement of fetus through the birth canal, and the relaxation of these muscles allow exit of the fetus from pelvis. Now, what are the muscles of pelvic floor? There are the 2 layers of muscles, superficial layer and deep layer. Superficial layer is composed of 5 muscles. External anal sphincter, it encircles the anus and is attached behind the coccyx. Okay. Transverse perineal muscle, this one, it passes from the ischial tuberosities and attaches here at the perineum. Okay, so 2 muscles are there. Then bulbocavernous muscle, this passes from the perineum, okay, and to the corpora cavernosa of the clitoris just under the pubic arch. Then ischio-cavernous muscle, they passes from the ischial tuberosities, okay, this one, along with the pubic arch to the corpora cavernosa. Fifth muscle is membranous sphincter of urethra. So urethra is covered by this muscle, membranous sphincter. This muscle fiber passing above and below the urethra and attached to the pubic bone. Since it is not circular, but again it acts as sphincter of urethra and closes urethra normally. Then deep layer of muscle composed of 3 paired muscles which together are known as levator ani muscles. So this, what is levator ani muscle? This is a group of muscles. They lift or elevate the anus. That's why they are called elevator ani. One is pubococcygeus muscle. It passes from the pubis to the coccyx. Okay, pubococcygeus muscle, with a few fibers crossing over the perineal body to form deepest part. Okay, so this is perineal body and it crosses. This is perineal body. Okay, the iliococcygeus muscle, it passes from the fascia covering the obturator internus. Okay, so what is iliococcygeus? This muscle up to coccyx, passes from the ischial spine to the coccyx in front of iliococcygeus muscle. The white line of the perineal body pelvic fascia to the coccyx. Okay, so this one is iliococcyx. Okay, it is broad here and then attaches to the coccyx. Then ischiococcyx muscle, it starts from the ischium. Okay, ischial spine and then enter to the some fiber to the coccyx and some to this sacrum. Okay, but we call it ischio-coccygeus muscle. Okay, now this pelvic floor, apart from muscles, it also contains some soft tissue that are known as pelvic fascia. This is loose areolar tissue and used like packing material in the space. The tissue fills the triangular space between the bulbocavernous and the ischio-cavernous muscle and the transverse perineal muscle, and this is known as triangular ligament. Then finally we come to the perineal body. What is perineal body? Actually, perineal body is muscular and fibrous tissue, diamond shaped, and it is situated between the rectum and vagina. Most muscles attaches to it while forming the pelvic floor, and its size is 4 cm. So it is all about female pelvis, its diameters. It is very important in midwifery. Thank you. Have a nice day.